You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. If you're missing one tooth, a few teeth, and especially if you have a loose-fitting denture, you have to hear what our first guest has to say. He's an expert on the topic, board-certified oral surgeon, Dr. Scharf. Dr. Scharf, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, tell me a little bit about your practice. Who's your typical patient? And as an oral surgeon, what are the procedures you do?
Well, Randy, my practice, we see a broad age range, as young as 4 to 5 years of age, all the way up to patients that are 99 to 100 years of age.
Is that right? 100-year-olds are going into the oral surgeon.
Believe it or not, that is true. I mean, you
oh, my goodness.
Believe it unless you were there. But we see all age ranges. We do various procedures as oral surgeons, from wisdom teeth extractions to other extractions, to surgery for obstructive sleep apnea, surgery for temporomandibular joint disease, also known as TMJ, to reconstructive surgery for patients that have had trauma or been in accidents. We work on them for reconstructive purposes, bone grafts, and we specialize in dental implants.
Okay, so a lot of people coming in, I mean, dental implants now has become mainstream.
Oh,
is that right?
It is absolutely mainstream. Patients are coming in, before we used to have to bring that up as an option, we have patients coming in asking about it. So
really?
That tells you how mainstream it is.
And now, by the way, in San Francisco, okay, and what area of San Francisco are you?
West Portal.
Okay, West Portal. Would you say there's tens of thousands of people that have either an upper or lower denture out there?
In West Portal and its surrounding areas, at least.
Okay, good. Very, very interesting. Okay, your background and training. Now, you were in the Air Force. Why don't you tell me a little bit about your background and training? When did you know you wanted to be a dentist? And then an oral surgeon, of course.
Sure. So, Randy, it was in college that I found out I wanted to be a dentist. I had a very good friend who I was in college with. He was going into dentistry at that time. I was still kind of had some things up in the air. I wasn't sure if I was going to pursue a medical field or go into dentistry. After chatting with him, he told me all the plus sides or the ups of being in dentistry. And so I kind of pursued it and went into dental school. At that point in time, I didn't know I was going to be an oral surgeon or I was going to specialize. I thought I was going to be a general dentist. It wasn't until in dental school I kind of learned about the different specialties of dentistry that I found kind of my true calling, oral surgery. To me, it's a mixture of medicine and dentistry together.
And you like it?
I love it.
And so you were in the Air Force?
Yes, Randy. I spent 3 years in the Air Force. I was in a major teaching hospital in San Antonio, Texas. So it allowed me to really build my scope of practice. One, being in a teaching center, you basically have to be on your A game. You're teaching residents, all right? Okay. So you got to be smarter than they've got to be, and these guys are smart nowadays. Secondly, because we're a major teaching hospital and one of the biggest hospitals in the United States, we would get patients, some of the more difficult or complicated, if you want to put patients, from other bases in the United States. So the amount of patients that we saw was just a huge number. We talked earlier, the 10,000 hour rule, a book that a lot of us have read. I know you read it too, Malcolm Gladwell, Outliers. It says in the book, it takes 10,000 hours to master your subject, whatever it is, whether it's dental implants, whether it's being a teacher, whether you're a construction worker, whatever you do, whatever your trade is, 10,000 hours to master that subject. So it's really not the age of the patient, of the doctor, or the physician, or whoever you're seeing. It's you want to go to somebody that's been doing it for a long time.
You know, when people ask us, they always ask us, they email us at wellnesshour.com, they want a referral, and we don't. We're not a referral site, just like this is a real interview. But I say go to a specialist. Go to somebody that's an expert in that, somebody that's done thousands of those procedures. So, and of course, you fit into that category as well. Now, what is it? Now, we're talking about dental implants today. You brought some models. I had a feeling you were going to bring models like that. What has changed? Why is it what used to take you guys a year, now you can do in a visit or two or just a few visits as far as dental implants?
When implants first came about, they were different shapes than they are now. They were made of different materials than they were. So like anything else, through the years, technology enhances, things get better. Nowadays, we have implants that are called root form, so they actually look like the roots of teeth.
Really?
That is correct, Randy. They actually look like the roots of teeth. So that's where the term root form comes from.
Okay.
They're made of pure titanium, which is one of the strongest metals that we have. So the strength of the implants nowadays are far stronger than what they used to be. And they're also specially coated nowadays with materials that can increase what we call osseointegration, which is just known as the bone and the implants are actually fusing together.
Okay.
That's where the strength comes from. So, previously implants would be placed, they would be buried. What that means is that they were actually not only in the bone but underneath the tissue. We would leave them that way for 6-9 months. Then patients would have to undergo a second surgery, the uncovering, and then they could start putting teeth onto those
It's
implants.
not like that anymore.
Not anymore. Now we can place implants that no longer need to be buried, which means you don't have to have a second surgery down the road.
I hear the same day. I mean, with the ideal candidate, that can happen.
With the ideal candidate,
Same day teeth kind of a thing.
exactly. That's where the term came from. You know, teeth in an hour, teeth the same day. Nowadays, with the technology that we have, with the implants that we have, an implant can go in the right patient. You can have that tooth the same day.
Now, you guys, and I spoke to your partner also. I mean, you guys are using technology where you do the case on a computer, or elaborate on that.
Yeah, so this is the latest technology. I mean, we're all about, my partner and I, we want to be on the cutting edge. We want to provide our patients the most up-to-date technology so they can get the best results possible. So the newest thing that's out there is we work with a company called Implant. Basically what's going on here is the patient gets a CT scan of their jaws. So what it does is it allows us to see three-dimensionally how much bone they have. We can evaluate their soft tissue, and then we can place these implants on a computerized model so they're in the exact position that they need to be. And then what we get, if you don't mind, I'll just show it. This is just an example of a surgical guide that is fabricated from this CT scan, and it's computer-based.
Take a look at this.
Yeah, it's
okay. So I think they could see that. It's just just right.
Yeah, it's
straightforward.
It's as accurate as you can get. I mean, basically.
So no more cutting of the gums. I mean, in certain cases.
Exactly.
That way it doesn't hurt as much.
Exactly. So this can be placed. The implants can be placed right through the hole. No incisions need to be made. The term flapless. Sometimes patients will hear the term flapless.
You know, I've talked to you guys, your partner, and he says, you know, pain is not something the patients complain about. Is that true? Is that right?
That's absolutely correct. That is one of the myths about implants.
It seems painful, though.
The thought of it, you know, it's this, the thought process or the fear that it's going to be painful. You know what I've heard fear stands for?
Okay,
have you heard it?
Go ahead.
False events appearing real.
All right.
Okay? So they think it's painful, but in reality, it's not.
Because the bone, I guess the bone doesn't have...
There's no nerve endings in bone. No nerve endings, so they don't feel any pain. And my partner and I, we both call all of our patients the night of surgery. That's something that we do because, you know, that's how we take care of our patients. And I get the same answers every time I call a patient that I place an implant on.
What do they say?
They say, I ask them how they're doing. They say, doctor, I'm doing surprisingly well. I didn't realize how much or minimal discomfort this actually is.
Is it true they could take like an Advil or aspirin or whatever the next day?
Absolutely. They call me. They actually, when I call them and talk with them, they say, doctor, I'm not taking any of my prescription pain medication. Is that okay? I said, that's absolutely okay. They think something is wrong because it's not hurting. So they expect pain. So when it doesn't hurt, they think something's gone wrong.
And your partner, we haven't mentioned him.
Yeah.
Dr. Duncan. You guys work together, kind of a team approach?
Team approach. If you come into our office, he's going to be the senior guy. So I'm kind of the young surgeon, jokingly. He's the senior surgeon, jokingly. But we work together. We show each other the cases. We talk about the cases. So what I tell patients, and he tells the patients the same, whether you're seeing him or you're seeing me, you're actually going to end up seeing both of us.
And he's been doing implants since the beginning.
Yes,
is that right?
Since the very beginning. So what we offer is kind of the best of both worlds. He's been there since the beginning. Obviously, he's got more expertise, more hours than I do. So I bring along the newer technology, kind of the state-of-the-art practice when it comes to implants. You know, being in the military, in the Air Force, having the utmost up-to-date training possible. So again, when patients come and see us, they're getting the best of both worlds.
Okay, good. In San Francisco, if there's tens of thousands of people that have either an upper or lower denture, and if dental implants are that good, you say, you know, 2 implants, give them something, snap in, snap out. Why aren't they all doing it?
Because, Randy, they don't go to their dentist anymore, as we talked about previously.
Okay, good point. All right.
Patients that have had dentures for 20 plus years, they stop going to their dentist because they don't feel a need to. So they don't know about it. They don't go to their dentist. They're not informed. Otherwise, I can guarantee you they'd be asking about implants. If I were to give them a trial period, if I had them come in and I just simply put 2 implants and had them go away for a month, 2 months, 6 months, they would never let me take them out.
They could come back.
Another thing, Randy, is that patients who maybe are 75 or older, you know, they've had some bad experiences going to the dentist before. They've had some failed root canals. You know, dentistry, you know, 15, 20 years ago.
It was different, huh?
Wasn't a pleasurable experience. Nowadays...
So they don't want to go. The last thing they want to do.
Afraid. Let me just throw a statistic out there.
Okay.
about adults that are 74 years of older, about 25%, a quarter of that population, missing all of their permanent teeth.
Really?
Correct. So I mean, these are people walking around in dentures. They don't know maybe what's out there because they haven't gone to their dentist, they've been given the information about implants, or like we just said, they've had a really bad experience in the past, they're afraid of pain or maybe cost.
Okay, now, in all areas of dentistry, okay, so you were in the Air Force, you've been in and around patients for a long time as an oral surgeon. Is this the happiest group of patients where you take a denture wear and give them something to snap in, snap out, or fixed?
Oh, absolutely. I mean, these are the patients that I love to treat because when they come back and see me, when they've got their final restorative or their final prosthesis,
Their teeth, when they get their teeth in.
Final teeth, whether it's something that snaps in or is fixed, these are the happiest patients out there. They're so thankful that we were able to offer this to them. It's totally changed their life.
The fixed teeth that you're giving, I mean, do they look better than the old dentures? I mean, I feel like I could spot a denture 10 yards away.
Absolutely. I mean, again, the changes that have occurred, the permanent teeth that we have, the fixed teeth, if you want to call them, they look 100% better than what dentures used to look like. I mean, we all know the denture patient. We can spot them across the room. We didn't really talk too much about what happens when you lose teeth, but I'm going to tell you, Randy, when you lose teeth, you lose bone, you lose soft tissue around that area. What ends up happening is you actually get facial changes. Your face changes.
How so?
It starts to sink in. Your nose starts to drop. There's no supporting structure. Your bone is your supporting structure. So when you miss that, your face actually changes. You look older than you really are.
Is there such thing as a happy denture wear, in your opinion?
I think that I wouldn't call them a happy denture wearer. They're just happy because they don't know that they could be more happy. You know, they don't know.
So they're just adapting, maybe?
They don't know that they're unhappy. Let me put it that way.
Okay.
They don't realize that they're unhappy.
Is this a kind of procedure where the person that used to wear dentures, that they go, I should have done this years ago?
Absolutely, absolutely.
And they can eat whatever they want? I mean,
they can eat whatever they want. They can chew what they want. They don't have to worry about something making noise, clicking with something that's a traditional denture, something popping out or coming loose. It takes stress off them when they go out to social events, or maybe they would always make excuses that they didn't want to attend a social event, or when it came time to eat, they would excuse themselves so they couldn't.
Interesting. Do you hear those kind of stories?
All the time, because they're just very concerned about people knowing that they have dentures in.
Okay, so no more dentures. Okay, you brought some models. What'd you bring us here?
So yeah, we'll start with the first model here. This is just the kind of one category of patients that we talked about, missing one tooth. Okay, so let's say you've lost one tooth in the middle and you've got natural healthy teeth on either side. Obviously, this is an ideal candidate for an implant. Main reason being is you get to preserve the healthy teeth on either side. Before we had dental implants, we would have to do a bridge. So that means you actually have to prepare or cut teeth on either side. It's still an option. It's a good option, but it's not the best option out there.
So every dentist would agree that a dental implant for one missing tooth is really the best way to go?
I think so, 100%.
Okay.
And so the way that it works is the implant is placed in that one spot that's missing, and then the actual tooth is made on top of it, and it can either be cemented or screwed on top of it.
And you just floss it just like a regular
treat
tooth?
it just like a normal
And
tooth.
it can last as long as your regular teeth?
As long or longer. The advantages of a dental implant, one is because it doesn't have the normal tooth structure, it can't have decay on it. So you can't get decay on an implant. As opposed to a bridge, because a bridge is connecting to healthy teeth, these healthy teeth are still subject to decay, gum disease, and other issues. If this bridge ever fails you, which they do, you can look it up yourself, but average lifespan for a dental bridge is 7 to 10 years. Now, some last longer, but that's about the average lifespan. So when a bridge fails, it's because one of the anchor teeth have failed. This is where that myth about expense comes into play. People think it's less expensive up front for a dental bridge, but it will fail before an implant does. And
so in the long run, it's probably less.
It is.
Is that what you're saying?
Absolutely, it is less.
Okay, so for the denture wear, what are their options?
So for the denture wear, we can start off with just 2 implants. So if I were to take a denture wear and place 2 implants.
Are you exaggerating over there? So they're snapped on?
They're snapped on.
Okay.
And there's a pretty tight connection there. I mean, you got to pull a fair amount to get these off. You know, somebody who is a traditional denture wearer, maybe they're 75 or 85. If I were to put 2 implants, they'd have a tough time getting this thing off.
Oh, really? Okay.
So basically, you've got 2 implants. They're called locators or abutments, and they basically fit into their traditional denture. You got to kind of a receiving piece up there, and it just kind of snaps in. Now this is obviously 100% better than a traditional denture, but it's not my favorite because it's still removable. It's still something that's got to come in and out. So
Okay.
that's
Okay.
the disadvantage of it. Moving on from there, you can have...
I mean, do you show these models to patients when they go into your office?
Absolutely. We give our patients all the options, so they know all the options. I will even talk to them if they're missing one tooth. I always tell them the option is a dental bridge, but I always give them the advantages and disadvantages. So they see...
You almost said you always give them the best option.
I give them the best option.
Okay.
Because if I were in that chair, I'd want the best option. If I had to go and if I had to get any type of surgery or anything done, or if I wanted to, I don't know, buy a cell phone that we talked about earlier, I'm going to want what's best for me. What's going to fit my needs.
All right.
So I got to give that to the patients.
Okay, so the next level up for denture wearers.
So instead of 2 implants, you can do 4 implants, and it can still be something that is basically, this is an example of what's called a bar and a clip. So you have 4 implants, you have a bar here, and then basically the denture clips on top.
And they can eat whatever they want with that.
They can eat whatever they want, steak, apples, things that they couldn't eat with their traditional denture. Now again, the only disadvantage of this, maybe a couple, one is it's still removable, so we're still talking about a removable device. It's not fixed, that has to come in and out. And also because this bar kind of sits up above the gum tissue, it's not really custom fit to the tissue. Sometimes you can have some more difficulty or more time spent on hygiene, keeping it clean.
Okay.
Sometimes a little more costly as far as replacing some of these clips can sometimes give out on you over time. So those are the kind of disadvantages of the removable prosthesis. Up from there, now we're talking about fixed. So we're getting kind of into the, in my opinion, the better prosthesis, something that is not removable. So a lot of patients, they don't want...
I mean, isn't that what everybody wants? I mean, if you're wearing a
That's
denture,
ideal.
you want something that doesn't come in and out.
Exactly. That's
Okay.
ideal. If you're going from something that comes in and out, you don't want that.
So when I hear terms like all on 4 or some of these teeth in a day, I mean, we're talking in an ideal situation. I mean, that's possible with this, what we're talking
Correct.
about.
So this is an example of something that would be kind of an all-on-4. All-on-4 just talks about how many implants...
Let me see that for a second.
So 4
Okay.
implants, you get something fixed in there.
So this could go and just goes right in there. It's
Goes
a,
right
it's a
in
set
there.
of teeth.
It's a set of teeth. It's
Supported on 4...
4 implants. It's
Interesting.
fixed. It doesn't
Okay.
come out, and it stays there permanently. So you don't have to worry about taking in and out.
That seems good. No, that seems like...
It seems very good. The only disadvantage to something like this is that the teeth are all connected to this, what we call a framework. So this is all one piece.
Okay.
So the only disadvantage is if one of these pieces or teeth happen to break or chip and it needs to be repaired, a lot of times this whole prosthesis has to come off. It has to go to the lab. They have to repair that tooth and then it comes back.
Does that ever happen?
It happens. It happens
Okay,
because
okay.
the way that these teeth are made of, it can happen.
What's it made of?
10 years.
Like something like that?
Typically, it can be made of porcelain. The teeth themselves can be made of porcelain or other materials. So these can chip or break.
Okay.
So that's the only disadvantage. Now, the newest thing that we have and that we offer at our practice is something that's called a titanium contoured frame. This is one piece. It's very lightweight. And basically, the main advantage to this titanium contoured frame is that it has individual teeth on them. So as opposed to this, the teeth are all connected.
That's like a denture,
It's like
in a way.
denture.
Okay.
The titanium contoured frame has individual teeth that are cemented on. They're basically the closest thing that we have of giving you your own new set of teeth because they're all individual teeth. So one tooth.
But what's the advantage? Okay, so what's the advantage there, though?
The advantage is that if a tooth breaks, you don't have to take the whole framework out. Everything stays in. They just treat that one tooth, just like if one of your teeth.
So it's like a
out,
titanium gum line in a way. Is that right? I mean, the way it looks?
the way it looks, and then they put actually pink material on it, so it actually is custom fit to your own gum. So the pink blends in with our gums because our gums are pink in color.
Yeah.
So it blends in. You really can't tell. It's very difficult to tell that transition line, and you get individual teeth on them.
So it's like having their own teeth again.
The closest thing.
I mean, do they forget after a while that they even have something in their mouth?
Yeah, I mean, I could just tell you of a story of a patient that I know that, he was a denture wearer, upper and lower dentures. He was having difficulty especially with the lower denture coming in and out. And a lot of times why people have difficulty mainly with their lower denture is because the strongest muscle in our body, our tongue, wants to push that denture out. All right, so it's very
Okay.
difficult for patients to get a sturdy lower denture. So he was having difficulty. He was tired of wearing it. We went through all the options, as I told you before. We go through all the options. He wanted the titanium contoured frame, the individual teeth.
Okay.
So he received it, and this guy is loving life. Okay. He's loving
Loving life.
He's loving life. He loves it so much. He's now coming back to have his upper denture done too. And his
Okay.
upper denture, it was
Like it felt loose in comparison?
it felt a little bit loose, but that wasn't his major concern when he came in. When he first saw us, he said, "You know what? My upper denture is fine. I don't want you guys doing anything. I just want my lower denture redone because I can't stand my lower denture." Now he's got the Rolls Royce, the individual teeth on the lower. He says, "Hey, I want the same thing on top. I can tell a difference." He can now tell the difference. He didn't know. He didn't know what the difference was.
And these look cosmetic? I mean, these are good-looking teeth?
If you need to, I'm not going to ask you if you have any
Okay.
crowns in your mouth.
I don't
That'd be
actually.
Personal, but patients who have crowns in their mouth, it's the same material. It's a crown. These are individual crowns. So
Interesting. And we're just about out of time. Okay, so a recap for somebody wearing dentures.
Yeah. So a recap: you can have 2 implants, something removable, snap.
So where do they go? They're like right up here, the front?
Right in the front. Right in the front.
Snap in, snap
Snap
out.
in, snap out, and you're going to get 100% plus stability compared to your traditional denture.
Could you eat with those? I mean, what could you eat with?
You can pretty much eat whatever you want with just those 2 implants.
All right.
The only disadvantage is it's still removable.
Okay, okay.
And then your next option is sometimes you can have 4 implants, and then you can have, but it's still snap in, snap out, so it's still removable. Or you can have something fixed, still with just 4 implants. So this is something that's permanent, that stays in. The only disadvantage is called a hybrid. The only disadvantage is that the teeth are not individual teeth; they're all connected. And then, of course, the best thing out there right now that we're offering.
You called it the Rolls Royce.
Rolls Royce. It's the individual.
Well, because you get your teeth back.
You get your teeth back.
And so they're like veneers? These individual teeth? They're porcelain?
They're porcelain. They're like crowns.
Oh, they're like crowns.
They're like
Okay.
crowns.
Are they strong? I mean,
Very strong. I mean, if anything, the implants are not going to fail. This thing's going to last you for life. The only thing that might need to be changed is a crown. Just like if you're walking around with a crown on one tooth, that might chip over time.
And every 6 months they come in?
I still
or a couple times a year?
I still recommend they come in for just normal daily prophylaxis hygiene. So it's always recommended.
Or not daily. You said you recommend that they come in daily. Every 6 months?
Every 6 months.
Okay.
For your routine cleanings and maintenance.
All right. And they don't stain?
The crowns typically they don't stain. They're not like natural teeth. Our natural
Okay.
teeth have little porosities in them. They can get coffee, chocolate, anything that's really dark in flavor can cause some staining of the teeth. That doesn't happen with these types of.
Have you had any relatives that you've done dental implants on?
Oh yeah, my own mother has a dental implant.
Oh, really? Okay.
She's probably the most dental phobic person out there. For some of the reasons we talked about earlier, she had a horrible experience when she was a dentist younger. She told me stories how they had to hold her down. She was afraid of the needle.
Okay.
So I mean, and now in this day and age, we offer sedation. We can make the.
Yeah, tell me about that, sedation dentistry, because oral surgeons, I guess that's part of what you do.
That is our specialty. I mean, that's kind of what separates us from a lot of the other specialties out there is our training in anesthesia and the levels of anesthesia that we can offer. We can offer anywhere from a light anesthesia, known as a twilight sedation, to some patients need a little bit more than that. We can offer that.
So IV sedation, are the people that are getting this done, are most of them getting IV sedation?
I would say the majority are. Those that don't want it, that are very comfortable, they don't need it.
No, but the oral sedation, I read an article anticipating this interview, that IV sedation is much safer
It is.
than even not having anything done.
It is.
Is that right?
The reason is because it lowers your stress. So stress is not good for anything. I mean, everyone knows out there, they read about stuff. It's everywhere, on internet, on newspapers. Stress causes this, stress causes that. It's bad for your heart, it's bad for your health. So an IV sedation takes that stress away.
So the highly anxious patient watching this,
Yes.
they go in there, and what if they have anxiety about the IV itself? I mean, do you give them something even
Yes.
before the IV?
We even give them something before.
Oh, is that right?
Exactly. We give them some Valium, so a pre-op medication to take an hour ahead of time. It starts to already relax them when they come into the office. We also will provide them with laughing gas, known as nitrous oxide, even before the sedation has begun. So they're already in a very comfortable state.
So they wake up,
So when they
and
wake
it's
up,
done.
they're done. They pretty much have no memory of the procedure at all.
Really? Okay.
Comfortable, correct. And that's what most patients want who are very highly anxious. They just want to be comfortable and they want to be done with it. And so when they wake up, they don't even realize they're done with the procedure.
Is that right? So somebody watching this, they go, they make an appointment. They how soon before they find out that they can do it, that they're candidates for one of these procedures?
Most of the time, that same day. The same
Okay.
day that we're able to see them, we can take some X-rays, we can evaluate them. They're going to know whether or not they're a candidate that same day. So it's a very quick time frame as far as turnaround. As far as they don't have to wait, they don't have to come in. I'm not going to get back to you in a couple weeks or a couple months. You'll find out that same day whether you're going to be a candidate for one of these procedures. And let me just say that everyone is a candidate, Randy. There's this misconception that, again, I'm not a candidate because I'm too old. I don't have enough bone. I've got some health problems. Everybody's a candidate.
I mean, if you're currently in cancer treatment or things like that, obviously, maybe not a good time to do
At
it,
that particular
or
time.
uncontrolled something. But
Uncontrolled something.
but for the
There's
most,
very few absolute contraindications.
I mean, if 90-year-olds are doing this, you're saying,
90-year-olds are doing it.
why would a 90-year-old want to do this?
Why wouldn't they? Does a 90-year-old not take vacations? Do they not go out to nice restaurants and be able to eat what they want to eat?
Okay.
I could tell you, if I was 90, I'd want to enjoy my life, right? I wouldn't want to just sit at home and not go outside because I'm 90, right? So if a 90-year-old wants to take vacations, enjoy life, go to restaurants, be social, why can't they have it?
So when I hear a 75-year-old telling me, my mother, by the way, saying, I was told I was too old for dental implants by my medical doctor, you're saying it's just not true?
Not true. Misconception. A misconception.
And it's not painful. I mean, pain is not something they complain about.
Pain is not something they complain about. We talked about cost. It's actually in the long term less expensive than other options such as a dental bridge. The misconception that we didn't talk about, but some patients come in and say, oh, I'm afraid the implant's going to be rejected. We didn't talk about
Like
success
falling
rate.
out. Yeah, what is the success rate?
Success rate 96% nationally.
Okay.
96%.
But with the imaging and things you're doing today, are those numbers even going down? I mean, you know,
I would say success rate's going up.
going up. I would say, yeah.
Yeah, success rate's going up. I mean, we track at our office probably 98, 90%, 99% success rate. So, 1%, 2%, meaning 1 out of every 100 or so might have an implant that fails for different reasons. But let me just tell you this, if an implant fails, it doesn't mean that game's over. We can do the implant again and they still have the same statistical success rate. So that's another misconception.
And go to somebody with a lot of experience.
Go to someone that does it over and over again that has a lot of experience. 10,000 hour rule.
Do they need a referral to see an oral surgeon? I mean, can they call you directly?
They can call us.
Will you do
directly.
that? They'll see
Yeah.
consults?
Now, obviously, a lot of our patients come from general dentists. They get referred over because they are established with a general dentist. And we also have a lot of patients that come in that don't have a general dentist. They call us. Either a lot of it's just word of mouth through our existing patients. So we've got friends of our patients that said, hey, I know you treated my patient and she's extremely happy with her results and I'm interested in implants. So they do not need a referral. They can call our office directly.
Okay, good. Okay, so no more dentures.
No more dentures.
Denture, a person wearing a denture or missing a lot of teeth, they need to go in there and find out their options.
Dentures are a thing of the past, just like the rotary phone is a thing of the past.
Okay, well, thank you for coming on the show. Very good.
Thank you for having me.
Excellent. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.